Today we are going to talk about heart stents and what it is all about, and who needs it, who gets it, and most importantly, actually today is how to look after the stent that you have had inserted by your cardiologist. This is a representation of blockages, and I'll go through it in a moment. As Dr. Zia said, we are streaming live from, in fact, 2 locations in CVSKL. One, Mary and myself, we are not in the same place. CVSKL is in New Sentral and is a cardiac vascular hospital where we do a lot of heart stenting. So first, just not to delay anymore, why would anyone need a heart stent? Well, heart stenting is for people who have blockages, who have narrowing of the coronary arteries. And when you get narrowing of the coronary arteries, it affects the flow of blood that carries oxygen to the heart muscle. And when the heart muscle does not have enough of oxygenated blood, just like when your leg muscles are tired because you've been walking too long, the leg muscles will ache if you walk too long, so too the heart will ache. And when it aches, when you walk a lot, your heart pumps harder because your body needs more blood. So your heart itself also needs more blood and more oxygen, then it starts to ache. And this aching will be in the central part of your chest, and that is what we call angina. So when you exert yourself, you don't have enough of oxygen to your heart muscle because of blockages, then you get the aching, and then when you rest, it starts to go away. That is what is very typical of heart blockage pain, and that is called angina pectoris. If the blockage is so severe and a blood clot forms where there is a blockage, then the blood no longer flows, then the muscle can actually have cell death. The muscle starts to die and form a scar, and that is what you call a heart attack. Right, so the stent procedure is to help prevent that, right? So in this representation, the blood is flowing, as you can see, and as the plaque becomes more and more, less and less of oxygenated, oxygen-carrying red blood cells will flow through. And sometimes if it's severe enough, the blood will just stop. And if the blood stops, that muscle will die if it doesn't get relief within a few hours, and that is what you call a heart attack. So what is the stent procedure then, right? The stent procedure, here I will do a swap of my program here. So I have to change, new share, and this one here. This. So a stent procedure is, we'll go to the beginning. So coronary angioplasty or ballooning or percutaneous, which means through the skin coronary intervention, is where we put a fine tube called a catheter. It goes usually from your groin or from your wrist all the way to your heart. And it sits right at the beginning of the heart vessel called the coronary artery. And then we will inject medicine called dye, and then we will find the blockage. And then when the doctor finds the blockage, they put a thin wire just to find the root of to make sure that the balloon travels in the middle of the vessel. And on top of this thin wire, very small wire and very fine and soft wire, we feed a tube called a catheter. And at the end of this catheter is a balloon. So when the balloon is correctly positioned by using X-ray imaging, then the doctor will inflate the balloon with liquid, and then it will push the blockage to the side. And then he will remove the balloon, and then he put a second balloon which has a metal mesh on top of it. The metal mesh nowadays is made out of alloys like cobalt chromium. It used to be made out of stainless steel, and this is what you call the stent. The stent will remain there, and this balloon will be removed. And the stent nowadays has medicine, because you need to treat you need to put medicine directly to where the cholesterol is so that it doesn't regrow so quickly, right? So this is what you call a stent. This tube then has to be removed, then that will allow blood to flow through the stented area again. So then I'll go back. So that is what you call a stent procedure. Yes, okay. So again, I'll just run through it again. So first, it is called, some people call it ballooning. The word we use is angioplasty, which is angio meaning the blood vessel, and plasty means to open, and it's to open narrowed coronary arteries. So the first tube is a catheter, which is inserted from the wrist or the groin and push all the way to the coronary artery using X-ray to make sure that we are in the right place, and then an injection of liquid into the artery through that first catheter, the first tube, to look for blockages. And when you see the blockage, a second catheter, which is smaller than the first one, is inserted into the first tube, and you push all the way to the blockage. And this has got a balloon at the end of this tube, and this balloon will then blow up against the blockage to push it to the side. And then finally, then you will then put the last balloon, which has a metal mesh like this, and then remove the balloon and leave behind this metal mesh called a stent. And again, nowadays, the stents all have medicine on them to help reduce the recurrence of blockages. Now, one of the big, there are two major problems that happen with stents. One is re-narrowing. Of course, we don't want to keep having to do ballooning again and again. So firstly, who are the people, or what are the stents, or what situations the stents more likely to reblock? Well, if you have very long blockages, right? So what we call diffusely narrowed blood vessels, and it's the whole, if you have very short blockage, those are the best for stenting. The longer the blockage, well, the higher the chance of re-narrowing. So if you have very long blockages, you may also need to have many stents. So more stents, more chance of re-narrowing. If the re-narrowing is at a branching area, that means where the blood vessels split into 2 or 3, then there's a higher chance of reblockage as well. And then if people who have had bypasses, they had stents put into the bypass, those also have a higher chance of reblockage. And one thing that also happens in the, especially in the past, where we don't have such good knowledge and equipment, is when the stents are not adequately placed in the best way, meaning that the stents have to be pushed right against the wall. So now those things are happening less and less because we have so much of more knowledge about how to place the stents, what kind of pressures to use. So the doctors with their experience know that when you do the stents in a certain way, the chance of reblockage is less. And on top of that, we have new equipment and new imaging devices. One is called the IVUS, which is intravascular ultrasound. Can you imagine the ultrasound can be done from within the blood vessel? Just the ultrasound probe is just as thin as a wire. Another one is what we call OCT, optical computed, I think that's tomography. I've forgotten the last term. It's called OCT. These are all fantastic new imaging devices that we use in cardiac centers such as ours to make sure that the stents are placed very well so that the chance of reblockage is less. So certain areas, the chance of reblockages are more, certain types of blockages is more, and certain without all the best equipment, then sometimes the blockages also have a higher chance of recurrence. But there are other factors as well that increase your chance of re-narrowing, such as if you have diabetes, there's a higher chance, especially if it's poorly controlled. If people continue to smoke cigarettes, there's a higher chance of re-narrowing. if the blood pressure is not well controlled, and if the LDL cholesterol is not well controlled. Here I can quickly mention that the targets for LDL for patients who have had ballooning have been set mainly at about 1.8 millimoles per liter and below, but there's a lot of new data to suggest that we should contemplate setting the target at 1.4, and some research studies have also suggested that going to as low as below 1.0 millimoles per liter shows that it reduces blockages coming back even more. One thing I want to add here quickly is that, you know, in all the studies, there's been no level to say that there is a level below which you have more complications. That means I sometimes hear patients say, you know, oh, you know, we need LDL cholesterol. You know, I'm not sure where they get that information from. I am sure they are not wrong. We might need some level of LDL, but as of now, there has been no research that showed that below a certain level, people have higher chance of Alzheimer's disease, depression, or cancer, or anything else. So the principle at the moment would be the lower the LDL, the better it is. Yeah. So to a person who has gone through a stent procedure, well, they have to try to observe all these things so that they don't have to have recurrences, especially since recurrences can possibly be dangerous as well. Yeah. So what do we need to do after a stent procedure? Well, just to know that usually people after a procedure will go home the same day, or maybe in Malaysia, the practice is usually to stay overnight and go home the next day. Where the injection site, you will have a very tiny wound. Just keep it dry and clean. And then most importantly, keep to the follow-up, because your doctor will want to check on the wound site and check on your overall condition. So he will schedule an appointment for you. So there's no specific thing you really need to take care of, but maybe just have a look if there is pain and swelling, and if it's hot, then sometimes you might need to call your doctor to see whether he needs to see you again. If you are having a fever though, then you probably may have a wound site infection, which is actually very, very rare. It's actually very rare. Do you need to contact the hospital? Well, if you have bleeding from the site, again, usually that's pretty much unheard of, because by the time you go back, all that should have pretty much settled. Sometimes there's a swelling. If it's just a bruise, then it will settle by itself. But if your hand changes color or leg changes color, then that is very, very rare. You really need to see the doctor as soon as possible. As I said, that's a very rare situation, and touch wood, we have not encountered that. Other reasons for checking with your doctor would be that if you have, those are all wound site complications. If you have complications of the stent, that means in the heart, then sometimes you can have chest pain or breathlessness that doesn't go away after more than 20 minutes. Or if you have an irregular pulse, especially if it's very, very fast, if you're giddy or even fainted, and of course, if you have fever and having a cough and phlegm, and if you have any problems taking your medicine, then you may need to call your doctor. Now, what can you do after your procedure? Most of the time nowadays, the procedure is done through the wrist. So a lot of people just can get off the table and will be sent back to the ward by wheelchair. They actually can even walk back, but we don't do that. We just send them back to the ward, and then they can have their dinner already. But in some places still, a lot of doctors are still puncturing the groin area. So then you have to lie flat on the bed for at least 6 hours, probably not get down from the bed overnight, and you can walk only the next day. For when you leave the hospital, well, you'll be pretty much walking out of hospital. I do advise people just to take things easy, not to start exercise for about until your first follow-up, which is in about 1 to 2 weeks. And after the first follow-up at 1 to 2 weeks, you can start moderate activity like just walking exercise. Then after about a month, then you can resume all full activity, right? Again, if the procedure was done through the groin, then we don't want you to walk up and down and don't want you to drive your car for about 2 days, because we don't want there to be a late bleed, a secondary bleed. So don't do too much of, don't overuse the right lower limb, because that's where the injection was through. If they did it through the wrist, same thing. You don't want to use your right wrist too much where they put the needle in. Aside from that, nothing very much. Sexual activity is just like exercise. Maybe, you know, after about 1 to 2 weeks, when you feel quite comfortable, then you can resume sexual activity as you have done before. So longer term, are there lifestyle changes? Well, people who people who need a stent, they have heart disease, right? And you have to look after these things because there's no sort of thing like you do a balloon and you'll be right. That's all. You don't need to see the doctor anymore. Unfortunately, it's not the case. You are always going to be a heart patient. People who look after this do very well. A lot of patients had stents 20 years ago and they do well. They just follow simple things that not just the stent patient has to do. Every patient should not smoke. Not every patient, everybody should not smoke. Everybody should have a healthy weight. They should have regular physical exercise and they should have enough of rest. Yeah, they should of course have a healthy diet. And luckily for me today, we have Puan Mary Esau, who's a very experienced dietitian who was previously in KPJ hospitals and then later on for many years in IJN and now helping us in Cardiac Vascular Sentral Kuala Lumpur. And Puan Mary Esau will be talking to you in great depth and much better than me about the diet. Yeah, so I'll leave that to Puan Mary Esau shortly after this. Sometimes after people go through all this, you do feel a bit worried, a bit anxious, maybe even a little bit depressed, and that's quite common. People start to be very aware of the heartbeat being a little bit out, or there's some funny discomforts. I think just most of the time is mild and something to talk to your doctor at the follow-up. But if it's more severe and affecting your sleep, it's not common for us Asians to talk about how we feel. But, you know, I think it's time that we learn that sometimes it's better to discuss this with your doctor. And we sometimes have to give people some medicine for a short while, but most of the time, this is just a passing thing and people do start to feel much better. Of course, after a stent, they start to feel much better because the circulation has improved in their heart. Now, your medications are very, very, very important, right? If you, as I said earlier, if you have diabetes, high cholesterol or high blood pressure, you must take the medications as prescribed, because controlling diabetes, high blood pressure, and high cholesterol is key to preventing recurrences, right? But on top of that, when people have stents, something specific to stents is that your doctor will give you at least one, almost 99% of the time, he'll give you 2 medicines to reduce blood clotting. Now, why is this? Now, as we showed you earlier, a stent is a metal mesh that is put inside of your coronary artery. And our body tends not to like foreign objects inside of it. So what does it do if we don't? I'll just show you this. If we don't take the so-called blood thinners, right? What happens is that in our blood, the platelets will start to see this foreign body, and it may stick to the foreign body like here. And if one platelet sticks to the foreign body, which in this case is the metal mesh called the stent, a second platelet You know platelets, I'm sure Malaysians all know platelets because platelets are the cells that go down when you have dengue. So platelets are to form clots in case you have a cut, you don't bleed to death. The platelets go to the where the cut is and stick to the cut and start to call other platelets, and from the platelet they call red cells and white cells and proteins and form a clot. So now in this instance where you have a stent, the platelets also recognize the stent as something foreign and will stick to the stent. But we don't want a platelet to stick to another platelet to stick to the stent and call the proteins and all and form a clot. So it's very important we avoid clotting when we have a stent. So we give doctors, if you form a clot within the stent, it's called stent thrombosis. And if you form a clot within the blood vessel where there's no outlet, you will just block the whole blood vessel suddenly. It can happen immediately after a stent. It can happen within the first 1 month after a stent, or even as late as a few years after the stent. But with the latest stents, it's becoming less and less frequent. And also with the latest blood thinners, you know, doctors often use the word blood thinners. Actually, it's not quite correct. It's not, we shouldn't use the word blood thinners. We should use the word antiplatelets, right? So we use at least 2 antiplatelets to help the platelets not stick to the stent and allow the blood to flow past the stent. But this is not forever. Now, why is it not forever? It's because after a while, a film of cells will form over the stent, and the stent is no longer exposed to the blood, right? So immediately after the stent procedure, you will have metal sitting inside of the blood vessel, and it will be exposed to all the cells in the blood. But after about a few months, the cells of the blood vessel, that means your artery cells, will grow over each of these struts, each of these metal struts here, and it will cover it. And platelets do not stick to this lining, right? So when you first put in the stent is on top of the lining. But after a few months, the lining grows over each of the metal struts. So during that period, the first few months after a stent, it is very important that you do take the blood thinners or the antiplatelet drugs, usually at least 2, and you do not stop. And it's very, very crucial not to stop. And if there's any problem, because well, people can get rashes, sometimes emergency operation must be done, very rarely. Then the doctors will have to deal with that situation to see how to keep the blood thin without and not cause a lot of bleeding. And on the other hand, you cannot stop it also because you have to stand there and not cause a thrombosis. So please remember that if you have any issues with the blood thinner, you must discuss it with your cardiologist, and only your cardiologist alone can decide with you. Yeah. So stent thrombosis is a very important issue. At the beginning of this talk, we forgot that Malaysia now, there's a lot of rules about everything. And this is a public talk involving a hospital, a pharmacy, and a pharmaceutical company. We are not allowed actually to mention drugs by name. So we will mention them by class. So there are many classes of antiplatelet, but the antiplatelets are very, very important. Should you feel there's a problem with your particular antiplatelet, you must discuss it with your cardiologist, right? So suppose you need to have your tooth extracted, well, do not stop. You have to talk to your cardiologist, and your cardiologist will have to discuss that with your dentist. Yeah. So again, after a stent procedure, it is very important, as we said, to rest, to recuperate, to have appropriate change in the lifestyle. But your drugs are key to the success of your stent. Your drugs must never ever be stopped, and you must always consult with the doctor who put the stent in. Yeah. So angioplasty is when you have a very severe blockage and it needs to be fixed up. But after you do an angioplasty and you put a stent, you have a slightly different problem. You can use problem in inverted commas. Your heart is better, but you have a stent that you need to look after. You need to understand your stent. So find out more about stents and find out how to look after the stent, and also how to prevent the need for a need for stenting again, because because we don't want to go through this kind of procedures again. So with that, I will end my talk down here. Thank you very much once again to Sanofi, Caring Pharmacy, and CVSKL for inviting me to talk about stents. At this point now, I think Puan Mary Esau, who is the senior consultant dietitian, will give us her talk on having a healthy diet. Puan Mary, thanks.